I am a ECP heart specialist working in a non-surgical cardiology, and we give freedom to the patients to avoid bypass and stenting in stable condition. And if you have heart failure, very less pumping. We are the masters in treating heart failure by ECP treatment, and it has been approved by FDA all over the world, including USA, Europe, Saudi, Russia, India, all over the world. But I am talking about ECP benefit that is well known, but my focus is that there are a lot of doctors who do podcast by paying to the anchors, or who do photo editing, video editing, and in the background of their video. But that is unnecessary expenses, and that expenses will be applied to the patient treatment. And the most important thing is that how doctor works at a ground level and give benefit to the patients, because ECP is considered as an alternative to the bypass surgery. If you are not willing to go for bypass surgery, there is a ECP. If you are suffering after bypass surgery or stenting, there is ECP. If in stable condition, if you are shown multiple blockages, you can take allopathic medicines as per clinical trials all over the world, and stabilize the blockage, reduce inflammation, and stabilize the heart and become heart attack proof. And after that, you take ECP treatment to revascularize the heart and develop new vessels and capillaries surrounding the blocked arteries, and open up and dilate the blocked arteries. That is a very good experience with ECP since 12 to 15 years, and it has been given tremendous results to the patients. But I am talking about the benefit of ECP can be exaggerated by your lifestyle, your way of habits. Suppose you are taking ECP treatment or any detox treatment, or you have gone for stenting, but if you constantly take tobacco or chewing pan with tobacco or smoking, so the beneficial effect will be nullified. Secondly, after treatment, if you become a couch potato like lifestyle, means sedentary lifestyle, then the effect of ECP and collateralization and natural bypass, angiogenesis, arteriogenesis will be nullified. It will not work so long. Normally, after one course of ECP, there is no need of second course. ECP is totally non-invasive. You can take it after 2 or 3 or 5 years if you have a problem like diabetes, high BP. And the most important aspect is that you have to avoid the food that is sugary. You have to avoid sugar and sugar-rich food like anything that is sugary, cold drinks, saturated fat milks items like Shrikhand, or anything that is highly saturated. And you can avoid this lassi vagere that can be highly sugary, and that can damage the endothelium of the artery, and in that bad cholesterol deposit and oxidize and become the blockages. When blockages become old, means after 5 years, there is a calcification is going to be occur. and that stabilize the plaque. Calcification is to stabilize the plaque. But people are very frustrated that my arteries are calcified and I will die at any time. Calcification has nothing to worry. It can be controlled by medicine. It can be controlled by EECP treatment by developing surrounding rerouting of the arterial blood supply in the heart, taking M7K2 capsules, vitamin D3 in a sufficient dose, and if you take any nitrous oxide donor fruit juice, half glass daily for 2 years, that will be very, very beneficial. Apple cider vinegar 1 teaspoon daily is very, very beneficial for calcification removing. So calcification can be treated by medicines, dietary habits, walking, avoiding junk food, and living exercise full life. Exercise means not going to gym. Just you have to walk. Brisk walk is the best exercise for the heart. Either you can cycling or you can jump the roads 10 minutes on empty stomach. But walking is the ultimate exercise, brisk walking. When you are walking, there is a chance of breathlessness slight. But you can talk to your walking partner. That is best walking exercise. You cannot walk slowly like Telna, means like very slowly you walk for 5 kilometers. That is not a walking. Walking, if you walk 2 kilometers or 3 kilometers, but it should be brisk or mild jogging. Don't go to gym for anaerobic exercises. It will create havoc. Sometimes it can create cardiac arrest by disrupting the electrical system of the heart. And if you want to do anaerobic exercise sometimes, then climb the stairs and come down the stairs. Do 10 times. Or if you park the car in the parking, up down, climb the parking slope and come on upper side, then go down, then go upper side. That you can do 5 to 10 times. That is not daily, but weekly once or twice or thrice you can do. Climbing and walking against resistance is a best exercise. Otherwise, daily on flat surface or grass surface, you can do brisk walking 30 to 35 minutes to 45 minutes as per your body's capacity and heart's capacity. But walking is the ultimate exercise. There is no need of gym or any protein powder or anything, nutritional supplements, nothing needed. Measure your B12, D3. That is the best to remove calcium from the arteries. And eat fruits that gives nitrous oxide. Take it directly, otherwise take half glass of its juice daily for 2 years, along with allopathic medical treatment and EECP treatment by trained specialist doctor. I am a member of International EECP Society, and I assure you that whenever you take treatment of International EECP Society members, you will get good results. Because EECP should be understood very carefully. It is not just a bubbling system. It is a science reciprocated with heart. So it is very complicated procedure, and that you have to constantly monitor it, and don't go in a franchisee ECP centers. Some doctors, I have seen that no oil diet doctors from Delhi, and they give franchises to non-medical persons. And there are a lot of doctors that they are doing medical treatment, ECP treatment only for money making purpose. That's not a good criteria. ECP is a very big, deep science. It should be taken with proper hand. And avoid all the bad habits like tobacco, alcohol, junk food, saturated food, late night dinner, outside dinner, and morning lunch with salad, and evening dinner as early as possible, before 7 or 8, it is okay. Then don't take anything as a food form, and keep your stomach light. And heart disease has been making how by these investigative procedures. Any percentage shown in angiography is not shown by ultrasound or FFS technique, and not a single pint is coming out from that. So it is a lump sum judgment of doctor, and people are frightened, furious, and anxious, and they go for surgical intervention or bypass. So take second opinion and go for intensive medical treatment, changes in habits, and go for the ECP by trained doctor. Thank you.